I wanted to begin by thanking Bill and Melissa and Katie for inviting me to join you all here today. This is a tremendous effort. When you look at the number of volunteers who are here today from the business community, whether it's WEX or LL Bean or Hannaford's or IDEX, all working together toward a common cause. If you look at this facility and its transformation, which was made possible in an extraordinarily short amount of time by the Risbera Brothers Construction, by Maine Properties, and others. When you look at the National Guard, which makes such a difference in helping to control the influx of people, orient them, give them directions, help them fill out the forms. They have made such a difference as well. I met retired and also current physicians and nurses and other healthcare providers, all of whom are eager to be here. The fact is that 1,500 people will go through this facility today and receive either their first or second vaccination. That is extraordinary, and it shows that these large-scale clinics are absolutely key to saving lives in this era of COVID. I am so impressed also with the gratitude of the patients who are here, the sticky notes that they have appended to the wall, express their gratitude in color, and they are telling everyone how relieved and happy they are to have the ability to get these shots. So to me, this is what Maine is all about. It's about people coming together, volunteering their time, donating their expertise, headed by MaineHealth, a great institution, to improve the quality of life and the health of the people who live in our great state. Now, MaineHealth has invested some $3.5 million in its clinics, and that is an extraordinary amount. And I can tell you that MaineHealth and other clinics across the state of Maine, rural hospitals, are not making money on this. They are doing it because they care about the people that they serve. I am very pleased that the December COVID bill that I helped to draft provided money for the first time for vaccine distribution, not just manufacture, and that has helped to make this clinic possible. I'm also pleased that just this week, the administration announced that they will raise the reimbursement for each shot that is given. It was on average about $28, not enough to cover the expense, even though the vaccine itself is free. But the cost of administering it, of having a facility, the $28 did not cover it. Now it's going to be $40 as of March 15th on average, and that is going to make a real difference and allow us to reach even more individuals. But most of all, I just want to congratulate MaineHealth, all of its partners, and all of the patients who have come forward and realize that they are protecting themselves, but also their family members, their neighbors, the grocery store employees, everyone with whom they interact by getting the vaccinations. All of us are so eager to return to normal, and getting vaccinated and wearing masks. I think it's funny that three of us have on the same state of Maine mask today. All of us working together can help bring about an end to this pandemic, which has caused such heartache for so many families and such economic devastation for so many businesses. Working together, we can get through this, and this clinic is an enormous step forward toward that goal. So my thanks to everyone who's been involved in this tremendous effort. Now, my only disappointment is I can't place a bet or get an ice cream cone anymore. But what a wonderful use for this facility. Thank you. And I'd be glad to answer any questions, and I'm sure Bill and Melissa would also. Or not, as the case may be.
Senator, 25% of Mainers are vaccinated, or at least that was the number yesterday, trickling up. The state plans to reopen more fully starting next week, with the governor lifting the caps on indoor gatherings. 50% outdoor gatherings can go back to 75% capacity, and then scaling up over the next 2 months. Are you concerned, given that we're having a little bit of rise in cases in Maine, that we're reopening too soon?
I'm not. I know that Governor Mills has consulted very closely with Dr. Shaw. I talked with Dr. Shaw myself last week because I'm very eager to get all schools reopened. I think it's absolutely critical. And I've been pressing the CDC in Washington to update its guidance, which they have just done today, I'm pleased to say, because I am hearing increasingly from parents, from educators, and from medical personnel that students who are not in school are not only losing out academically, but starting to have social and emotional problems. So we're seeing a real increase in behavioral health problems among our students. Getting them back to school full-time is the best thing that we can do for them in a safe way. And increasingly, the evidence shows that masks are far more important than deep cleaning, for example. And you don't have to be 6 feet apart. You can be 3 feet apart when you're talking about children. And as Dr. Shaw told me, the risk of transmission in a school is far less than in the community. So I think we have to start gradually reopening and getting back to normal. But obviously, the uptick in the number of cases is concerning. I read Dr. Shaw's comments on that. He thinks it may be due to the variants. But vaccinations are going to help us get on top of that. And as he pointed out, hospitalizations and deaths are down. So I think that that the gradual reopening makes sense.
And so with those new guidelines from 6 feet to 3 feet, is your message to schools, 268 districts in Maine, hyper-local control, I know that, but great disparity in how they've been dealing with the 6 foot, 3 foot. What do you say to schools that have been, with teachers' unions insisting on it, sticking more with the 6 foot rule? Should they change as of today?
My hope is that those schools will take a hard look at the new CDC guidance, which is finally updated. I have been encouraging the CDC to update its guidance after talking to numerous public health experts all over the country and reviewing the latest studies, which showed that you did not have to be 6 feet apart in a school, that 3 feet was adequate. And for most schools, that's been the challenge. They just don't have the space to have students 6 feet apart. So I hope that schools will take a look at that new guidance, but obviously it is a local decision. And obviously if a school has had an outbreak, they need to be more cautious and react differently than a school that has not. But I really think that we need to weigh the adverse health consequences of schools being closed when we make these decisions. But ultimately, it is a local decision. You're right.
Senator, the FEMA just announced that it will be providing financial assistance for some funeral-related expenses for people who have died from COVID-19. This funding came from the American Rescue Plan, which you voted against. Are you for using federal funding for this type of expenses?
I was not aware that that is going to occur, and I don't know how much money is involved or whether there's a means test for it. I would note that the amount of money for vaccine manufacture and distribution was exactly the same in the president's proposal as in the substitute that I offered. Unfortunately, there were a lot of provisions that were included in the substitute that were not focused on the pandemic and were extremely costly. But the specific one that you've mentioned, I'm not sure how that's going to work. I was aware that there was extra funding for FEMA, but I was not aware that it was going to help for funeral expenses.
I'm going to be the person to switch topics
Sure.
on you.
There's always one.
I know, the girl from Maine. So I know you released a statement yesterday in light of the violence that we're seeing across the country,
Yes.
targeted at those of Asian descent. Can you just speak a little bit more about your feelings on that and how much you attribute, if any, to the previous administration for the violence?
Well, first let me say that violence against any group is completely unacceptable in this country. And the rise in hate crimes against Asian Americans is deplorable. They are our friends, our neighbors, our fellow Americans, and they contribute greatly to our country. And I condemn in the strongest possible terms the violence that we've seen occur in Georgia. I know there was an incident in Portland where we're still learning the details as well. As far as your second part of your question, it's very hard to know whether people are reacting to President Trump referring to the virus as the Chinese virus. The virus did, in fact, start in China. The Spanish flu was called the Spanish flu in the 1918, I think it was. So I don't know whether there's a correlation, but what I do know is that everyone should speak out against this violence. Everyone.
To your point, though, something you just said about the Spanish flu, the reason why it's called the Spanish flu was because they were the first ones to acknowledge it. So, by President Trump repeatedly saying it's a Chinese virus, it's the Kung flu and things like that, do you think that had anything to do with these attacks?
I don't think he should call it the Kung flu. That is totally inappropriate. What I'm saying, and I've had numerous Intelligence Committee briefings on this, that there is no doubt that the virus originated in Wuhan, China. And we don't know whether there was an accidental release from the lab that it studies viruses there, or whether it was a naturally occurring virus, but it did originate there. But that's no excuse for prejudice against the Asian Americans. One has nothing to do with the other. Nothing.
They also said, the last administration, that China was hacking our election when the intelligence reports all say it was Russia.
Correct.
I mean, that can't help the situation, people who'd be moved by
Correct.
that kind of rhetoric.
You're absolutely right that there is no evidence that China was as active in the last elections as Russia. But Russia, China, and Iran all have influence programs in this country to try to influence public opinion. China is renowned for stealing intellectual property, and is an adversary, as is Russia, as is Iran. But none of that changes the fact that whether we're talking about Chinese Americans or Russian Americans or Iranian Americans or Black Americans, prejudice and violence are unacceptable, period.
Last question.
You want to extend the PPP deadline. Is
Yes.
money left on the table?
There is.
Why? What's your goal there?
The PPP program, the Paycheck Protection Program, of which I was the chief architect, is helping so many of our small businesses survive in the state of Maine. And many of them, particularly in the hospitality industry, need a second forgivable loan in order to keep paying their employees. Unfortunately, the deadline for applying for these loans is March 31st. So I've introduced a bipartisan bill to extend it through the end of June, the next quarter. Actually, it'd be the end of May, and then give another month for SBA to process the loans. And that bill passed the House last week, and it will be on the Senate floor this week. Because of the transition in administrations and the fact that only this week did we confirm a new SBA administrator, the program hasn't progressed as quickly as it normally would. The Biden administration, for example, changed some of the guidelines, which created great confusion among our community banks and credit unions. And I think that's all sorted out now, and that the demand is still very much there, particularly for seasonal businesses.
What would the new deadline be?
It would be the end of May, May 31st, but then with another month for SBA to process the application. So if you applied at the very end of May, you're not shut out because SBA didn't have time to review and approve the application.